First, healthcare centers and facilities should be categorized based on their location, capacity, and their specialty capabilities. This ensures that Bangkok's major medical centers focus on complex trauma, while community hospitals handle lower acuity patients. In this case, mobile medical teams should also be positioned at key transportation points, airports, border crossing, train stations. These teams can provide initial triage and stabilization before directing patients to appropriate facilities. All this requires a unified command structure that coordinates information flow and resource distribution with Bangkok as a coordinating hub, relying for quick decision making at the local level. Now, it's important to understand that also the WHO EMT teams, the specialized teams, have been deployed to the region, and they will also be integrating with the host countries. That would be in Thailand and also in Myanmar. Supply chain disruptions pose an immediate threat. Emergency managers within this context, they really need to assess critical medical supplies across all facilities and redistribute resources from less affected to more affected areas. Workforce capacity presents another challenge, and it doesn't matter what disaster, but in particular in this one, Thailand should consider mobilizing retired healthcare professionals and advanced medical students while implementing staffing models that extend specialty coverage. Telemedicine, in this regard, can really bring expertise from less affected regions to where it's really needed most. Information systems are really the backbone of an effective response. Real-time bed tracking systems, standardized documentation, and also patient tracking for those transferred from Myanmar are essential for maintaining continuity of care. Perhaps most importantly, Thailand must balance the earthquake response with ongoing healthcare needs. This means implementing rapid medication refill protocols and expanding telehealth services for patients with chronic conditions and those who still need care during the crisis. So Thailand should establish a unified coordination center that integrates international assistance into its emergency management structure. This prevents the creation of parallel systems that often lead to confusion and duplication. Again, this is where the WHO EMT teams can take a lead. The cluster approach, when predetermined in terms of the Thai government, this leads with paired and relevant international organizations providing that structure and response while maintaining local leadership. Of course, this is really important to have practiced this to work out the kinks before any major incident. Liaison officers then were going to be exchanged between Thai authorities and international groups to ensure a continuous information flow and alignment of priorities. Previous disasters have really given us valuable lessons. For example, the 2004 Indian Ocean tsunami highlighted the importance of local leadership. The 2015 Nepal earthquake demonstrated the need for coordinated medical team registration, and Typhoon Haiyan in 2013 showed the value of joint needs assessment. All of this has been taken account under the WHO Emergency Medical Team Initiative that leads global response. And by implementing strategic resource allocation, addressing key vulnerabilities, coordinating effectively with international partners, Thailand can mount a really effective response while really building greater resilience for future crises. So we learn a lot from that perspective. The most successful approach will integrate cross-zone coordination, strategic resource management, protection of the vulnerable populations, and a transition from reactive response to a proactive preparation.